Hello, my name is Denise Johnson, and I am the Project Coordinator for Substance Use Disorder and Mental Health Issues for individuals who are deaf, hard of hearing, and deaf-blind throughout the state of Wisconsin. I work at Independence First in Milwaukee, and I collaborate with all of the independent living centers around our state. Today I'd like to talk a little bit about how to work with an interpreter. Specifically in terms of working with an American Sign Language interpreter. In 2010, a law was passed that says that it is required for American Sign Language interpreters working in Wisconsin to be licensed and certified. It's also important to know that if a deaf, hard of hearing, or deafblind individual requests an interpreter, the Americans with Disabilities Act dictates that their request must be complied with. Now I'll talk a little bit about how to work with an interpreter. The first thing I'll talk about is appropriate eye contact. It's important for the person who is deaf or hard of hearing to be able to make eye contact with the service provider. That being said, the best place for the interpreter to be positioned is going to be next to and slightly behind the service provider on either side. The reason for this is that it will help the person who is deaf or hard of hearing and the service provider maintain eye contact with each other. If the interpreter sits off to one side, that connection that happens when eye contact is established will be broken, as the person who is deaf or hard of hearing looks off to the side to see the interpreter and then looks back at the service provider. You can definitely feel that shift when the interpreter is not placed correctly. The rapport has been lost. So it's important to have the interpreter sit just next to and behind the person who's speaking. Also important to know is that family members and friends should never be used as interpreters for a situation of any severity. These kinds of things include hospital settings, legal settings, counseling, therapy, any kind of incarceration. In those kinds of settings, it is required that an appropriate accommodation, such as an American Sign Language interpreter, be brought in. Along those same lines, I cannot emphasize enough how inappropriate it is to use a child as an interpreter. Children should never be used to interpret under any circumstances. That can be extremely traumatizing for the child, and what's more, children are not equipped to deal with the language levels that are used by adults. They don't have the same kind of vocabulary and, of course, don't have any of the required qualifications. Using a child to interpret will cause misunderstandings, and so it's never appropriate to use children for any situation, from the most mild to the most serious. Also, it's important that when working with an interpreter, you look directly at the person that you're working with and not at the interpreter. You also don't need to add the words "tell him" or "tell her," because that's an assumed part of the process and the interpreter will interpret appropriately. Also, try to keep to a normal pace of speaking, remembering that the interpreter is processing a message between American Sign Language and English, and so needs maybe a little extra time to complete that process. You may experience a little bit of a lag in your message going back and forth, but that's simply to make sure that the other person understands and vice versa. Remember that interpreters are trained professionals. Typically their first language is English, so first they learn American Sign Language and then they complete the required coursework to obtain a degree to become a professional interpreter. This process takes years and years of training and commitment. Interpreters are also required to abide by a strict code of ethics, which ensures that they will maintain confidentiality and neutrality in their role, facilitating cultural information and language information. They will not be taking sides with one person or the other, but they'll remain neutral throughout that process. Their job is to work as a team with all parties involved to make sure that mutual understanding happens. It's also important to know that interpreters are responsible for interpreting anything they can hear in their immediate environment. That includes noises in the room, sirens outside, that includes phone conversations that you may have. They can interpret the one side that they can hear. That is part of their job, and it's not appropriate to ask an interpreter to omit certain parts of what they can hear. If you need to have a private conversation, it would be best to ask the caller to call you back at another time when you can have that conversation in private. I think that's all for now on this topic, but I encourage you to take a look at the other videos on our website and also all of the wonderful resources available on the internet. Thanks so much for watching.